Are we rolling?
Okay.
Yeah.
Cool. So we are so lucky to be here. My name is Jeva Carr, and I am a part of HeartMath Healthcare. And we have doctors and a nurse executive here with us from two hospital systems that are learning these tools and techniques for reducing stress and increasing resilience in our healthcare workers and providers. And we've been in dialogue about the relationship between nurses and physicians, and so many rich things are coming out of it that we wanted to share. So, Gail, I would love it if you would begin, and maybe you guys could each just introduce yourselves and what hospital system you're with and your role.
Thank you, Jeva. I'm Gail Novak, and I'm enjoying the California sunshine, which is gleaming into my eyes right now. I'm the Vice President of Nursing at St. John Hospital in Detroit, Michigan. And I'm very honored to be here to interact with these colleagues from a West Coast hospital in partnership with them. You want me to open around questions? We've been in conversation about our opportunities, in particular as physicians and as nurses, to further develop our capacity to learn from each other, especially as it relates to communication. And one of our greatest opportunities is to access each other's skills around communication. One being that physicians have an opportunity to teach nurses how to speak or how to talk, and nurses have a great opportunity to teach physicians how to listen, because for each discipline, those are skills that we've really learned in our respective fields. And physicians have this wonderful capacity to get right to the point and to convey the necessary information. And nurses have this wonderful skill to capture a patient's story and to learn about them and what is underneath, what is not being said, what is not known, what is their history. So it's our opportunity to learn from one another.
And Priya, if you would introduce yourself, you said something in our program earlier today that I'd never heard from a doctor about your relationship with nurses and the nursing profession, and I would love for you to share it with other nurses who didn't get to be in the room with us today.
My pleasure, thank you. I'm Priya Nand. I'm an infectious disease consultant at Sequoia Hospital in Redwood City, California. And I think it's so wonderful that we have great nurses who can make that connection with the patient. This came up in our discussion earlier when we were talking about intuition, and one of the types of intuition was energy systems, or energy sensitivity. And when I'm walking into a patient's room, I might bring so many other things in my head with me, and I'm not there with the patient all the time. But you nurses spend so much time with the patient, and you make a connection that is so valuable to me. When I don't have the time to listen to my patient or read between the lines, I rely on you, and I so appreciate that skill that you have, because I must say it has saved me so many times where I could have just discharged a patient or treated them for a different thing, when what they needed was something that you diagnosed, that you helped me with. So I really, really appreciate you nurses and everything that you bring to our profession. Thank you.
Thank you, Priya. It brought tears to my eyes the first time you said it, and now. And I would love to hear from you, Beverly, when we were sort of joking around in the room about role-playing different professions to speak into the listening of, and everyone said, okay, now we're going to be doctors. And one of the nurses in the room said, okay, well, thanks for the promotion. And Beverly, you said, moving from a nurse to a physician isn't a promotion because we all work together.
Right.
I'd love for you to speak to that.
So my name's Beverly Joyce. I'm an OBGYN physician at Sequoia Hospital in Redwood City. It's a Dignity Health hospital. And I've been privileged to work there for about 20 years, and I've been chief of our department for probably 5 years off and on. And I know when I first came to, well, when I first was a resident in OBGYN, the labor and delivery nurses were who you turned to. When you had a question, you didn't want to wake up your chief resident, you certainly didn't want to wake up the attending. And the nurses were actually really good at teaching the interns. And so I always had taken that with me as a very beneficial part of my education. And realized as I sort of went into practice that having dialogue with the nurses was really beneficial, because they're the ones that are taking care of the patients primarily, and they know the ins and outs of the social history better than I do. Even after I've seen an OB patient for 9 months, sometimes I'll walk in the room of a patient and the nurse is calling her by a different name, and I'm like, I never knew that was your nickname, Katie. You know.
I so relate to that. Yes, absolutely.
Yeah, so I think it's really, really important that we partner with nurses as opposed to having a hierarchical sort of stratum.
So one question I pose to the three of you, because we've discussed a lot today, how nurses are often in communication feeling intimidated by physicians. Because physicians have this very efficient, direct lifestyle where they're managing so many details, and their communications can be abrupt and staccato and direct, and the nurses that we're working with feel like that's a personal assault in some way when it may not be. And vice versa, sometimes the nurses, because they're in this more relational, deep history with the patient, have more to say than the physicians feel like they have time to hear. And it causes this rift between physicians and nurses. How do the three of you see creating better working relationships and communications between physicians and nurses?
For starters, for each of us, there's a practice that I invite others, nurses and others, physicians and others, to engage in, as we have an inclination when we do run into conflict of any kind, even mild conflict, of taking it personally, or even energetically from another individual. They may have said nothing to us. They may not even be aware of our presence, but something about them and their energy makes us think, did I do something wrong? Have I upset her? And so the practice of that Miguel Ruiz guides us to in the Four Agreements is to take nothing personally, to recognize that all of our reactions to others are about us. They're not about others. And so if we allow our heads to draw conclusions about, I think that Bev's mad at me about something, and I haven't asked her, I have no idea. So just holding that space to say, I don't know what's going on, so I'm going to ask the question. And the flip side of that is to, in storytelling, to practice, okay, this is the story. What is the essence of the story? What does the doctor need to hear to be able to guide them in their next question or in their next treatment? What is it that I heard that I think is important that the doctor doesn't need the whole story. She needs the essence of the story.
And I appreciate when a nurse calls me that they give me the essence. And you don't have to start the conversation by, I'm sorry to wake you, I know it's 3 a.m. I'm like, right, get on with whatever it is you're calling me about, because we both know it's 3 a.m. and we both know that you just called me.
Yes.
Yeah, if it's a labor patient, she's 32, it's her first baby, she's 40 weeks, she came in ruptured, she's contracting, and her exam is blah, 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 needs some admission orders. Perfect. And then they can say, oh, and her husband's out of town, and she has, her mother-in-law with her, and then you can tell me a little bit of that, but maybe I don't need to know that at 3 a.m. But it's additional information that needs to come after the important stuff. And I very much respect a nurse, even if she called me at 3 a.m., who gives me all of the information up front right away.
Yeah, there's that piece of communication that we often forget, and that is just taking a few seconds to prepare is, what is it that I need, and what do I need to say in order to get what I need? That can save so much time and pain as we go on.
And do you feel like the HeartMath skills that you've been learning here could help nurses and physicians bridge? It's almost as I'm listening to you speak about this, there's like a rhythm gap. The rhythm of nursing is different than the rhythm of being a doctor. And they're crucial partners in the process of healthcare, and we need to bridge that rhythm gap. So I'm curious if you think the HeartMath tools would help bridge that rhythm gap.
Absolutely. And they're tools that are pertinent to all of us, because they apply not only to the work we do together, but just in our own lives. Because they, as we practice them, it guides us to just, it's an instant to take that pause.
And prepare.
And be sensitive to other. You know, it is 3 a.m. and, you know, I slept yesterday. You didn't. You were in the office. So just being sensitive to other and what their needs are.
And I think, as you mentioned earlier, sort of sometimes having to read between the lines. A nurse might be calling me because she's scared about something else, not because that's what's bothering her, right? And I've also heard that at night, when a nurse is supposed, when a nurse decides to call a physician at night, that she has to have a plan. Don't call a doctor if you don't know what you're going to do. I don't know if it's true. That really bothers me. I don't think that should be true. I think if you're calling, it's okay to call me and say, this and this is happening. I want to know what I should do right now, so I'm doing the right thing. For example, if the Foley has some sediments, according to your teaching in nursing school, you're supposed to say, doctor, do you want to do a urine culture? I don't think that's necessary. That doctor, even at 3 in the morning, can make the decision. I wouldn't recommend maybe calling a doctor for that if it's been happening for a while, right? And that's where you can make that decision of what is, prioritize your question. That doesn't need to happen at 3 in the morning. That can wait until 8 in the morning or 6 in the morning even. So we as physicians do need to recognize sometimes that you might not be calling for one specific thing, one specific order or whatever it might be. Sometimes you're just worried about something else that might be going on that you can't really identify. And sometimes talking to us, I always do this. I ask, if I have a question that doesn't make sense to me, I say, well, what else, right? Was there anything else you wanted from me, or was this it? I try my best to ask that question because I get so much out of that sometimes.
Well, and that's where I think this listening tool
Yeah.
can be particularly
Yes.
helpful, especially if you center yourself,
Yeah.
try and feel some compassion for the other person.
Yeah.
What is it they're really trying to tell me? And,
Yeah.
and sometimes you get that energy that there's something additional.
Especially when there is that hierarchy in medicine now, right? The doctor makes the order, the nurse follows the order and does everything else that the doctor has written for. But it doesn't. It's teamwork, and that's how it is. We wouldn't be successful without you. So yeah, don't ever fear calling us.
Well, and we wouldn't have patients to take care of without you. So.
Thank you all so much for gathering for this. Is there anything else you want to say to the nurse and physician population other than thank you all for your incredible work and service?
I hope we are successful in bringing these HeartMath tools to our physicians, and our nurses are already learning them, and I think having the same language among the doctors and the nurses is going to make a huge difference.
Yeah. I think that example of using this in the OR room, where the nurses knew it and the doctor said, what is this you're doing? Doing it together? Oh my gosh, that's so powerful.
And we're just really excited about bringing this to our organization because they're such practical, in the moment, real time tools that we can use as we're doing our work. We don't have to go home and practice. We will go home and practice them at night, but these are tools to be used on the go. So we're very grateful for that.
And I will say to you guys, as a patient, I definitely want to be in the hospital where the nurses and the doctors share this common language and are working as